Tiff in the office today. You guys are going to see Tiff's adjustment. Tiff works on a computer.
Most days.
Most days, like 8 hours a day.
Mm-hmm.
She started here last year.
Yeah, last year.
Last year as a chiro patient. She works out with us over in Beat Fitness. She's a great mover these days, right? I think yeah. So she's getting into that go-to pattern, the go-to movement. It's helping speed up and improve her chiropractic adjustments. She's a wonderful person who has taken her healthcare into her hands, and she started to, you know, put extracurricular time into learning how to do things the right way, exercising a little bit, postural exercises that she can include at home on the computer, a little bit of back stretching, right, stuff like that to help reduce some of the neck tension. Were you having headaches at all, or no?
No headaches, no.
Headaches, but ear ringing.
Ear ringing, yeah.
And that was left side or right side?
Right side.
Right side ear ringing. So sometimes you can get tinnitus or tinnitus, as some people call it. Ringing in the ears, it can be persistent for a long period of time, for days, constant, or it can kind of come and go depending on stress levels, environmental changes, lymphatic congestion up in the throat, the neck, but also cervical cranial issues and occipital neuralgia issues, so like irritation of those upper cervical nerves that can really create dysfunction up in the earlobes themselves. Did we talk on any appointments about ear stretching?
Yes.
Yes, nice. So for you guys at home, one of the best things that you can do is start to get comfortable tugging on your ear, grabbing your lobe, and just kind of moving. I like to move in a forward or a clockwise fashion, and just start to kind of stretch the eustachian tube out. So a lot of people get clogged eustachian tubes, which can cause bacteria, fluid, viral infection buildup, fungal infection buildup, and do you hear any clicking, popping?
Yeah, a little bit,
You
yeah.
do, right? So sometimes, and I'm going to zoom, Bree will come over and I'll kind of, let's see if I can get a little ear. Listen to this, guys. Ready? Run. All right, one more here. That was a good one. So don't try this at home until you practice or you work with a healthcare practitioner. All right, good. Those are ear or eustachian tube adjustments that instantly help to drain fluid out of your ears, out of your lymph nodes in your mandible and your jaw, and down into the back of your throat. Isn't that cool, right? So, yes, you can adjust your earlobes. You can get your cartilage to crack, and you can open up the passageways for stuff, for things up in the head, neck to drain. Let's scooch forward a little bit for you, and just look straight down for me. So with Tiff, head up now, we feel some sweet, not so sweet.
I was going to say sweet in a bad way.
Sweet in a bad way, crunchiness on this right side, big time crunchiness. Is that, I'm pressing lightly, but how sore is that?
Actually not super sore, but I could tell something's there.
Yeah. So she's got some, you know, sweet or wicked, whatever, I like those terms. Sweet, wicked, crunchy fibers up in the neck, a little bit on the left side.
Yep.
But a lot in the mid-cervical spine on the right side. And this is where she's got some scar tissue or fibrous tissue developed up around the upper trapezius, the cervical erector spinae, and some of these neck muscles that run down into the mid-back. We also quickly check where she's at in her CT junction and mid-scapular region. And we have a little kink, a little vertebrae kink over here on the left side. And we've got a little bit of tension down here in the right. Down here in the right mid-thoracic spine, okay? So, excuse me, today we're gonna start with some soft tissue treatment up around the SCM, the sternocleidomastoid muscle, the base of the occiput, down into the mid-cervical spine as well. And we're gonna use Sombra like you guys have seen many times before. We're gonna start with some light, just scanning of the neck. Tiff's been adjusted probably, what would you say, 10, 12?
I was going to say 10 actually, probably 10 times.
Yeah, probably about 10 times over the past year. Generally feel pretty well?
Yeah, and I would say I kept coming into the chiropractic office and you guys would give me stretches to do, and I was not disciplined with them at all. I would just keep coming in and being like, oh, you know, I can't, nothing with the stretches was really making sense. And then I started going over to the Beat Fitness side, and I think that's when everything really started clicking with the movements, and then I became more disciplined with my stretches, so I would say going over to that side has helped a lot.
Nice. Did you work out prior?
Yes, I used to just do things on my own. I would go to a gym and just do cardio. I was actually always afraid of doing things with weights because I was worried I would get really bulky and I didn't want to do that, but that's not the case at all. You could get lean muscle from that, and it's more not so much focusing on building muscle, but also just patterning movement and things like that as well.
Awesome. Patterning your movement, right? So here in our office, and every office is a little different, but we have something that's called like a clinic gym hybrid, right? So we have a lot of active chiropractic patients that come in for a number of different conditions, whether it's like neck pain, headaches, shoulder pain, whatever, maybe just general care. And here in the office, we do a couple things. One, muscle work. You guys have heard that before. Two, our skeletal adjustments, our extremity adjustments, our spinal adjustments. Three, we try each appointment to include anywhere from like 1 to 3 or 1 to 4 exercises, like simple postural exercises that are directed to anybody, right? So we have people like Tiff that are more computer-based. You're working from home, yeah. So she's got her home office set up, and we'll try, on different appointments to talk about different, desk stretches and stuff to do. If you're willing, we recommend, hey, why don't you come into the gym a couple days a week and actually learn how to spend an hour of your day, 1 hour of your day with high intensity interval training, which we do a number of different exercises. Some of them are just mobility based, no weights. Some of them are weight based, right? Whether it's like a barbell, dumbbell, kettlebell. A lot of patterning, as she said, a lot of like, hey, here's how your technique should look, here's how your body should move. If you move this way, you will experience improvement in your chiropractic adjustments. You're going to become more mindful, more aware, and as Tiff said, more disciplined to try to loosen your body up at home on a day-to-day basis. One of the sayings I like is that a brain at rest stays at rest, a brain in motion stays in motion. A body at rest stays at rest, and a body in motion stays in motion. So when you are starting into an exercise program, it's difficult, right? Definitely the commitment. Oh, I gotta maybe get in the car and drive to the gym. Maybe I'm busy at work for 8 or 10 hours a day and I've got all this stress and I can skip my workout today. And maybe it is, look down for me right there. Maybe it's just difficult because you've never done it before, or maybe you're scared to get too bulky, which doesn't happen overnight, right? So many people, there was just a lady in here last night, she says, I thought that when I was going to start weightlifting, I was going to like bulk up, and I don't want that bulky frame.
That's exactly what I was thinking too.
But it takes a real long time to get bulky. It doesn't happen in 2 weeks or 3 weeks. So don't use the bulkiness excuse as a reason to not exercise. Some cardio, could be some biking, but really the best kind of exercise that you can do is a variety of all of it. A little bit of stretching, a little bit of weightlifting, a little bit of running, a little bit of rowing, skiing, or whatever it is. But that mixture of interval training and switching between one exercise to the next and the next exercise. In our gym, we go anywhere from like 45 seconds to 8-minute or even 10-minute rounds with a 20-second up to a minute break in between sets. So timing scheme changes, exercises change on a daily basis. You're getting acclimated in the gym right now with hundreds of exercises with correct technique and correct form, which is awesome. Going to the gym, for you guys on the channel, going to the gym is sometimes it's daunting, it's scary, it's getting comfortable in a new environment, right? And that's hard. So, try to find a buddy, try to find a friend, try to find a group or a coach or somebody that can help motivate you to, try to do things with intention, exercise with intention. Don't just exercise, say, I want a 6-pack. You should walk into your workout, you should say, I want to exercise because it's really good for my body, it's really good for my mind. It helps reduce the stress of the day, hopefully.
Definitely does, yeah.
Definitely good. You take all that built up, pent up work stress, life stress, home stress, family stress, world stress, so much stress in the world, and you focus your energy on building your body better and learning something new. And that's an amazing thing because we never want to stop learning. All right, now we're gonna work necks. We did lateral neck. She got a little hair in there, sorry.
Yeah, I'm sorry.
That's right. We did the lateral neck treatment. Now we're gonna work down into upper thoracic spine. Those ILS muscles, the iliocostalis, the longissimus, and right against the spine. the spinalis muscles, they're called. We're also going to hit the levator scap, the upper trap, some of the rhomboids. Look up straight for me, look down straight for me. Look up, look down, look up, look down, look up, look down, look up, look down. And now, let's also hit a little bit of arm here and relax down, and then arm forward work as well. And arm backward, and arm forward. And arm backward, and arm forward. And now arm backward, arm forward. Nice. Now we're going to do left side.
I think of a lot of causes of the knots and issues that I have on my right side is when I'm sitting down at the desk sometimes, I find myself having my legs over here and my upper body this way, so it's like just twisting everything the wrong way and causing everything to have
Is
issues.
that because your computer screen's crooked or just...
It's because it feels comfortable to me for some reason. I think I just got so stuck in a pattern, like a bad pattern that my body was in, that I just got used to it.
Yeah.
But now I probably should just be sitting straight on, but that almost seems unnatural to me, so it's a lot of keeping that in mind to be more
Repatterning,
yeah
right?
yeah
And that's just it. Like so many people, guys, girls, they'll cross their legs one way over and over and over, day in, day out. And then we have to ask them like, yo, are you sitting like this all the time or like this all the time? Are you balancing that out and doing this or this? Are you sitting too much to the left and we need to twist over to the right side? Your muscles, they're formable. They're like plastic. Your brain, there's a process you guys can Google called neuroplasticity. That means it's like brushing your teeth. When you're a little kid, you're like, I don't know what to do. And then by the time you're 10, 12, 20 years old, now I'm really good at brushing my teeth. My hands are patterned, right? And neuroplasticity is taking a new exercise and it's doing it over and over and over again so that you can develop good habits. Cool? Let's go face down. A beautiful, beautiful piece to neuroplasticity, to brain growth, to musculoskeletal balance and symmetry. All right, nice. So we're going to use your feet for an example today as well. All right, let's watch what happens here, and you're just relax. Okay, guys, so you might be able to tell here how the left heel is a little lower than the right heel, or a little higher, excuse me. The right heel is a little lower than the left heel. When we straighten her out, watch what happens to this left leg. See how it kind of like springs up into that pattern? And she showed us already how she sits with that right shoulder back and like the hips turned to the left. So she's got a little bit of torsion in her lumbar spine, a little bit of imbalance down in the legs. Let's bend this leg up. Let's see that this gets about, let's say 1 inch, 1.5 inches away. Let's back down. Let's bend up here. And this side's definitely 3, 4, 5, 6 inches away. So a little tighter in the left quad. Push into my hand for me. Stop. Push. Stop. Push. Sometimes we get those cracky knee adjustments just from a little stretching. Push. Stop. Push. And stop. And Tiff, why don't you tell us push? Just from doing like the warm-up. Doesn't it feel good to just get your body moving?
oh definitely, from the going to the gym and doing the warm-up.
Yep.
I think that's what really hit home when I was talking about not understanding the stretches on the chiropractic side and then going over to the gym side.
Push.
A lot of the warm-ups that we do help you with proper posture.
Push.
And not only proper posture to do throughout the day, but also proper weightlifting and making sure that you have the proper posture doing that, because then you could help yourself from preventing injury as well.
Push. Nice. Stop. Push. And stop. Good. All right, back down. All right, so a little bit of change, but not too much. So now we're going to do, guys, a little treatment up and down the low back. Is it okay if I raise this up a little bit? And then we're just going to roll these down just one right there. Focus on in the low back is kind of like this left QL region. How much pain? Any pain, no pain?
Scale of 1 to 10, like a 2.
2. Nice. You can kind of feel like a little bit down in there. And what we're working on, guys, like the lumbar erectors, the low lumbar erectors, the QL muscle. The QL muscle, it's like this triangle shaped muscle that goes from here down to the hip crest, here to here. And QL muscles, if we sit in this kind of like crooked position, one QL gets tight, other QL gets stretched out, right? So we want to do a little muscle reduction, a little muscle treatment, a little manual therapy or myofascial release up and down through the QLs, just to help elongate some of the muscle fibers, find any of the tight spots, the trigger points, which she has just a little bit of tension right through the left side. And we'll see what the right side feels like as well. Here in our office, myself and Dr. China, we focus a lot on the muscle system, the fascial system, and we try to find all the tight, irritated spots so that we can reduce the tightness, promote circulation, which you guys are seeing already, blood flow down into the low back, blood flow into the skin or the connective tissue underneath. And she can feel there's that little kind of like spot right through there. So that's your sore spot, I would believe, right there. And she still does have a little bit of low back injury, a little bit of sprained vertebrae. Do you feel that's like kind of crunchy right through there a little bit? So those, when you come in for treatment every month or 2 months, these are some of the areas that we just want to focus on.
One thing that also has really helped to the low back pain has also been going on the hyper vibe and just doing the low back stretch on that. That has been incredible.
Yeah, whole body vibration machine, guys. You guys will see some of the videos on the YouTube channel. But tons of back chain dominant work, right? So we'll stand on the hyper vibe. We'll let that vibration get up into the legs, up into the low back. The vibration helps loosen up a lot of the muscles, helps to improve circulation. And it helps to resonate or send vibration, that energy up through the muscles to really kind of balance out everything. All right, let's go. All right, nice. Okay, adjustment time, kiddo. Tilt head back just a little baby bit right there. Take deep breath in. Exhale down, whole way down. Nice, one more shoulders. Good, breath in. Exhale down, relax that mid. Good, one more breath in. And exhale down for me. 1, 2, good. One more breath in, and exhale down. 1, 2, there we go. So sometimes you've got to do a little double pump. The double pump is like a short adjustment, then a longer adjustment. You guys probably heard that last one. We had to go a little deeper with our adjustments. Now we're gonna go right side up first, over to the window. We're gonna cross and cross. Take deep breath in, exhale, roll, easy, easy. Oh,
that one was,
Okay, nice. Now this left side might be a little tighter, but we'll see how she adjusts as well. Across here. Inhale deep, one more in, exhale out, roll, easy here. Nice, 1, 2, flat on your back. Okay, good work, kid. So, we got lumbar spine adjustments, we got nice thoracic adjustments. We're going to treat feet, and what we do with our feet here in our clinic is we work on this inversion. Inversion is lateral ankle stretching, it's peroneal stretching, and she's already good there. A little bit of toe decompression on the right. There goes a little adjustment in the cuboid bone. And big toe, nice. Okay. Now feet and right foot. Good. Tiff, how tall are you?
5'10".
5'10". Tiff has got lots of leverage, lots of leverage. Long bones make us speedsters.
I don't know about that.
if we train, we get long leverage, long arms, long legs, long distance between our sprints, our runs, our gait. But we also have increased risk, relax here, for dysfunction, right? The faster we go, and sometimes the taller we are, the more difficult it can be for some people to kind of connect their brain to their body and move well. So when kids go through their growth spurts, so many parents come in with kids, they say, oh my gosh, he's going through this growth spurt. He doesn't even he runs so crooked now, right? Your brain, it kind of forgets as you grow how to maintain the balance and the symmetry that you had as a little shorter child. So as we age, we want to definitely work on our patterning, right? Our patterning of our walk, our patterning of our stance, so that we can balance everything out through the legs, through the pelvis, through the spine. Nice. And I'll elbow gently. We're gonna go real easy right here. Did we have your elbows adjusted?
Never.
Yet?
That's
No.
why.
It gets a little scary because it's like the arm bar. All right, easy here. All right, we're not gonna push
That's
that
too
yet.
tight.
So, full extension. Tiff works on a computer. It's common to get like tight forearm flexors, tight biceps.
Even my fingers, yeah, this one was a little better.
Let's see this thumb here. Nice. And now let's go this way. What we will see as time goes on is that she will have a little bit easier elbow adjustments. Elbow adjustments, once you get the elbows loose, they stay loose. You can adjust the joints nice and easy, improving circulation and blood flow down into the elbow. All right, neck. Last key point. Relax left neck here. Nice. Relax right neck here. Nice job, kiddo. Okay, cool work, man. Hey guys, you've seen us on the videos today talk about the double bow set lie. The double bow set lie. Tiff is already nicely balanced out. You can feel your hip muscles work.
Yes.
Try to straighten your head up for me a little bit. There you go, perfect. Try to focus on the feet pressing together. Let's gently focus. You guys can see how she's a little more dominant with the right knee out than the left knee. Let's twist the left knee out just a little bit. Nice. Feel how shaky in those hip muscles.
And I already am cramping.
Already cramping. Cramping's a sign of muscle weakness.
Yeah.
All right, take a break then. Touch the bottom of the feet together. Cramping, guys, when we do these exercises, our goal is to find the crampy muscles, the muscles that we overpower very quickly, and they kind of go into this safe protective mode. It's like a cramp, right? You guys can again notice how her right knee's out, but her left knee needs to go a little further out. Let's twist left knee out. Beautiful. And you guys will see how that left hip shakes. So she's got a little instability, a little weakness up in the left hip musculature. And that translates up into the left side pelvis and over into that left side low back that you saw that we worked on a little bit more. Gently focus on right knee open. And still a little bit of strength work to gain here, but it should be a lot easier. You guys can see how much easier she can twist that right knee out. She got another adjustment in the foot ankle. Now let's go left knee out. And do you notice how that side's like your tougher side?
Yeah.
Okay. Oh, tons of shake. Go, go, go. A little more knee out. Perfect. Hold right there. And now we're listening what I like to call the short circuit. Short circuit is where your brain, it kind of is like, what do I do here? What muscles do I control? And how do I get this hip to develop stability? This is part of our double bow set lie. And we're going to recommend that Tiff does this at home when she lays in bed at night. She can close her eyes, cross her arms over her chest, and just kind of like lay here and work on this nice, easy double foot press, which is a little stronger on the right than the left side. And she's going to work on developing that pelvic floor, the adductors. You may get some cramping even up in the thigh, probably more on the left side. So if I say gently twist that left knee open, she's going to softly spend time focusing on how this left leg, and you guys will see the IT band, the glute med, and some of that stuff twitch up there. Now let's go right knee out gently. And that side needs a little work, but it doesn't need as much work. It's a little stronger. She's going to work on a nice deep breath in, and as we exhale, just a little firmer pressure through the feet. And now deep breath in. All right, guys, so we're finishing up with Tiff right here. We're working on her strong stilts of her arms, the locked out position of the elbows, so that gradually we can reduce tension in the common flexor tendon, the bicep tendon, and this fossa right here, this elbow crease. So fingers straight forward, shoulder blades back gently, nice. And just as Tiff feels this, we're going to point out how this side wings a little bit, but this side wings a little bit more. So we're going to say left shoulder blade back gradually, left elbow straight for 10, 20, 30 seconds. Focus on that nice little stretch in the elbow, perfect. And now let's focus on the right side. And now right shoulder blade back a little bit. And she's really going to work on pumping up this tricep. You see how she's growing this nice big guy right here, this nice big tricep. Not bulky, it's cut and lean though, right? So a little bit of postural awareness, a little bit of break, 2 minutes every hour to help build the back chain up, to help stretch the neck out, to help reduce tension up in the pecs, and also to help kind of improve the flexibility down here in the biceps and the forearm flexors. Cool? Let's relax the arms now. Let's see if we can hit this right shoulder. Relax this guy here, and easy little shoulder adjustment, and that side as well. Nice, dude. All right, there's Tiff's appointment. She's had some ear ringing on the right side, which is decreased with chiropractic treatment pretty nicely. When we first started working with her, she was a little bit kinked up on the right side, a little bit on the left side. Adjustments over the past year have gotten much easier. She's also improving her strength over at the gym, which is awesome. Getting lean, mean, bulky, but learning good technique, not bulky, sorry, but learning good technique as she's exercising and good movement patterns. We complimented her the other week because she's learning how to feel the flow, the energy move through the body with every step that she takes. Cool.
Thanks, Dan.
Thank you so much. We'll see you guys later on.